the American Academy of Pediatrics has issued new guidelines on how to treat childhood obesity. So context here, previously they took a watch and wait approach to childhood obesity because a lot of children grow out of it. A lot of children don't, but they didn't advocate that small children, because we have like fat kids in our country now, like little kids, sometimes toddlers who are fat. And they didn't advocate any diet or exercise for little kids. They just said you'll take care of it when the child is older. Well, they've revamped their recommendations, and now the American Academy of Pediatrics has begun to advocate for children to be put on drugs and to undergo surgery if the children are fat. I find this to be very unsurprising coming from the American Academy of Pediatrics. This is what NPR says. The group, the American Academy of Pediatrics, is now advising pediatricians to offer treatment options early and at the highest available intensity for obese children. The most effective interventions require upwards of 26 hours over 3 to 12 months of intense in-person behavior and lifestyle treatment from healthcare providers. Such treatment includes coaching on nutrition, physical activity, and changes in behavior, such as role modeling by parents. This approach should be used for kids 6 and older and may be recommended for those as young as 2 and their families. After this intensive therapy, weight loss drugs should be considered for adolescents as young as 12, the American Academy of Pediatrics says, while teens 13 and older with severe obesity should be evaluated for weight loss surgery. This push, NPR writes, to treat obesity earlier comes on the heels of the approval for children 12 and up of a new weight loss medicine called Wegovy, a weekly injection of a drug that is also used to treat diabetes. Ho-ho! Well, there you go. The American Academy of Pediatrics, once again in bed with Big Pharma. What do they want to do? They don't want healthy children. They want drugged children. They want children poked and prodded and stuffed full of anything produced by Big Pharma that profits these Big Pharma companies. Of course they want to medicate your kids. Of course they want to advocate for surgery. Maybe the problem here that they're ignoring, maybe the problem is trash food, that we're feeding our children garbage. That's obviously the problem. No exercise, too many screens, and garbage food. This is actually a relatively simple problem to resolve. A relatively simple problem. But what's their solution? To profit financially and ideologically. When they use this phrase, the whole child approach, it reeks of social emotional learning, which is a neo-Marxist education pedagogy in public schools that's actually quack psychology practiced by unlicensed individuals like teachers and school administrators to try to reshape and reform children's minds to quote unquote learn better. It's really, really nasty stuff, and the American Academy of Pediatrics is now advocating for it as well. Parents, reject it.